In this video, we're going to be talking about psychological factors that are impacting the way that people think and behave when it comes to COVID. And I'm delighted to be joined by Dr. Michael Hoerger. Dr. Hoerger is an international expert in psychosocial oncology as well as pandemic mitigation. He's an associate professor of psychology, psychiatry, and oncology at Tulane University in Louisiana and managing director of palliative care research at the University Medical Center of New Orleans. Mike's written over 100 publications in psychology and medicine. His research focuses on improving quality of life by reducing the emotional and physical burden of serious illness and on helping people to make decisions that will reduce the risk of serious health outcomes. Mike also leads a major COVID forecasting project in the US and is an expert on mitigation strategies to protect people's health. So Mike, it's great to have you on the video to talk about this, what I think is a really important topic. I want to start by asking you, why are we even talking about COVID? It's 2025, we're in the 6th year of the pandemic. Are the health risks from COVID still something that people should be thinking about and paying attention to?
Thank you. It's really great to be here. I appreciate you putting this on. I think this year more than ever, people should be taking COVID seriously because we know more about COVID than we have at any point in the past. And so a lot of people think that COVID is something that happened for 9 months or a year or 2 years and may not be as aware of the literature as to what is actually happening. And so there are a lot of reasons to take COVID seriously in 2025. We know that transmission remains high in a lot of places with annual or twice annual waves. We know that anytime somebody gets COVID, they have the potential to get long COVID, which is the development of long-term health conditions from the virus. And we know that people are continuing to die from COVID. It's just less of the acute deaths where people are getting hospitalized and dying very quickly. People are still dying at a very high rate, and it just tends to be spaced out a little bit longer after their infection and attributed often to other causes like cardiovascular disease.
Yeah, for sure. And I think in the context of schools, one of the concerns that is often raised is that, most kids are healthy, they have an acute infection, they seem to bounce back, within a week or two. Similarly, most teachers, we can talk about the people who are not in the group of most, but certainly most young and healthy adults recover well from the acute infection. And it seems to me like probably the longer term health risks for the bulk of the population should be more of a concern than the acute health risks. Would that be a fair comment?
Yeah, I think that's a fair comment at this stage of the pandemic. So early on, the first 15 months or so, I think people were right to be very focused on the acute outcomes because so many people were getting hospitalized. There was no vaccine for a long time, and then there was and still is some limitations on access to vaccines. But really, after people were able to get vaccinated, that helped improve a lot of the acute outcomes. But what we're still seeing is that people are dealing with long-term effects after they get infections, and the effects are pretty heterogeneous and potentially serious. In children, a recent high-quality study suggested that COVID is actually the most common chronic health condition in children. And so that's something to take very seriously. Even though children may get sick and may bounce back for some period of time, they may have lingering long-term effects, which may manifest in all sorts of different ways. It's often very difficult to know what's going on with children specifically, especially younger kids, because they can't accurately report on what's happening. But it may look like severe fatigue. It may be difficulties with attention and concentration and memory and those sorts of issues. And it could be other more obviously severe outcomes, but it's quite damaging to kids. And for teachers, the effects of chronic reinfections are also quite serious and often more telling, with teachers often being middle-aged and being at higher risk for severe outcomes, and also potentially having comorbid conditions that could predispose them to more serious outcomes, where hopefully most kids aren't having a lot of predisposed health conditions at that age.
Yeah, and you raise an important point about people having existing health conditions, because in any school, there are going to be multiple families who have a person in that family with a serious health condition. And of course, you work with cancer patients. So can you talk briefly about what the kind of risk profile is for someone who either has cancer or is undergoing chemotherapy or has some other kind of serious chronic health condition?
Yeah, so if somebody has cancer, especially if they are in that acute phase of treatment, they are the largest group at high risk of severe outcomes of COVID. And so, of course, any family could have somebody who has cancer and is going through cancer treatment at that point in time. And so that's an example that I think most people find pretty relatable is trying to protect a family member who has cancer. And if you have cancer and you get COVID, you're at higher risk of hospitalization. A common sort of problem is with any sort of infection, any illness, even if it were just an acute illness, is you often have to stop your treatments. And so we know that's very important. If somebody has a delay in treatment, that can have a very serious impact on their chances of survival, enough that that's been a long-standing focus in oncology, is getting people timely access to treatment. So you see hospitalizations, treatment delays. Sometimes the delays can be several weeks, sometimes it can be months, sometimes somebody never gets back on their treatments again. And then you also see premature death. If somebody gets a COVID infection, well, they have cancer. And so that's cancer. That's one serious health condition, but there are many health conditions that people have. Any type of immunocompromising condition or immunosuppressing treatment that someone may have could present a similar risk. If somebody was getting a transplant or just had a chronic immunocompromising condition. So, and that could be a child as well. Most of the time we're thinking about protecting parents or grandparents, but kids have serious health problems too. And so that's part of why it's important for schools to take these precautions very seriously, is you have a community of people that are at known high risk, and so that percentage of the population is high enough that any school should be taking it seriously, even if their goal is just to protect the most high risk people. And so you can think of risk stratification along a continuum. You have somebody with metastatic cancer who's getting treatment, they're extremely high risk. You have somebody who's getting an organ transplant, they're extremely high risk. But there's gradations of risk, and even somebody who doesn't have a known serious health condition can get long COVID, could develop a cardiovascular condition and have a heart attack 3 months later, 6 months later. So, but just to put it in concrete terms, in the United States, there was a paper that came out, I believe in one of the JAMA journals, probably about a year and a half or 2 years ago, and it estimated that about 6.6% of the U.S. population has an immunocompromising health condition. And so that's when you consider the size of a classroom and the size of families, that means just about any classroom is going to have someone there who either has an immunocompromising condition or has a family member who does. In fact, probably several people are in that circumstance. So it's just a part of making an inclusive environment, while also acknowledging that everyone has some level of risk, that it's not that we can just simply identify the highest risk people and solely protect them.
Yeah, that makes a lot of sense. And I think, if we talk about shared values, I think, every school leader, every teacher would absolutely want to protect the health of people in their school community. So I don't think there's any question about the kind of values that we're dealing with here in terms of protecting vulnerable people or people who might become vulnerable as a result of getting another COVID infection. But I guess one of the really critical issues, and the reason that we're kind of addressing this topic today, is that people have by and large become really reluctant to talk about COVID. And I think it varies a lot from place to place, and different circles have different attitudes towards it. But in general, there seems to be a reluctance not just to discuss the health risks and what to do about them, but even to think about it. And there's lots of good reasons for that, and I totally understand it. I would love to not have to talk or think about COVID ever again. I'm sure you would too. But really interested to get your thoughts on what some of the barriers are from a psychological perspective, and I guess in practical terms, what we can do to try and overcome those in a way that allows people to be able to engage in the topic without it being confrontational or triggering those kind of defenses.
Yeah, I think that's a really important issue. So I've spent most of my career studying topics that are controversial, that are difficult for people to talk about emotionally. So I do a lot of work in cancer, do a lot of work in COVID. I've done work on topics like shame, that are difficult for people to talk about. I've done work on this type of care called palliative care, which in the United States, that just means care focused on quality of life for somebody who's very ill. Um, 10 years ago, people thought that was controversial and thought it was a death panel or something like that. There's a lot of misconceptions about it. But any of these topics I've mentioned, um, at times when I've mentioned them, I've witnessed disgust reactions. The same reaction, like if you ate some food that was rancid or something, of just hearing the term cancer or COVID or palliative care itself can be so off-putting to people because it's so triggering of an emotional response. And as a psychologist, the overarching sort of key to mental health long term is self-awareness, awareness of one's reality and the reality of their surroundings. And reality is very threatening. It's hard for people to accurately take in reality all the time. And sometimes it can be much easier in the short run to engage in psychological sort of tricks that lower that immediate sort of anxiety or concern that people might have, even though over the long term it's just going to cause more and more problems for people. And so that's just very core sort of mental health philosophy, and that's across psychological disciplines and perspectives, whatever sort of therapist or mental health counselor or whomever someone might talk to is embracing reality is challenging and is key to psychological health. So people have all these tricks to try to deal with those intense emotions that, as I said, tend to cause problems in the long run, but in the immediate term, they may cause some immediate relief. And so a good example is psychological defense mechanisms. These are kind of like ways of coping, but usually when psychologists talk about coping, it's something that you're more proactive about, you're more consciously aware of. The idea of psychological defense mechanisms is that these are things that you're doing without necessarily thinking about them in a very active way. They're happening automatically, and you may not even be aware that they're fulfilling some kind of coping, short-term coping mechanism for you, or that they could be potentially damaging in the long run. And everyone engages in this to some extent. So if you're like me, you may watch sporting events, right? And so in the United States, a lot of people watch American football, which is very brutal, but there's all sorts of dangerous sports. So whatever somebody might like. But you have to kind of suspend that thought about how dangerous it is while you're watching it and how it can be damaging and all this, or else no one would watch it, right? So,
For sure.
so a lot of people engage in that on a, hopefully less serious basis on a day-to-day sort of behavior. But with COVID, people engage in all sorts of defense mechanisms. A common one is denial, and so denial is basically just completely denying the reality of the situation. And so in a very blunt sort of way, COVID is over, the pandemic is over, COVID is a cold, COVID is the flu, things like that, where it's just completely shutting out reality. And there was a famous interview of our previous president, President Biden, where he was on the show 60 Minutes, which is like one of the big weekly news shows here. And he was being interviewed casually, walking around, and he said, the pandemic is over. Of course, COVID is still happening, but it was just one of these things where you could see how everyone can kind of buy into that, of just this abrupt sort of deletion of reality.
Yeah, I've seen that with lots of occasions actually where people have latched on to something that it's almost a permissive kind of thing that says I now have permission to believe that because I've heard it from someone that I can kind of say, well, it was my doctor or someone else who says you don't need to worry about this.
Yeah, and I think that makes it easier for people, especially if it's someone that they look up to, they respect, they identify with politically, whatever it might be. And so
Hmm.
that just makes the whole process a little bit easier because with any of these defenses, there's some awareness sort of percolating just below the surface. And part of the psychological trick is how do you push that back down so it's not entering into your thoughts and leading you to change your behavior in some way. So it, denial is a pretty, I mean, it's a pretty serious defense mechanism because it's so counter to this idea of awareness and of reality. I mean, it's doing the exact opposite without much thought. Um, the defense mechanisms range from very simple and concrete like that to extremely elaborate. And so I think it can be difficult for people to even realize when they're engaging in these defense mechanisms. And people may engage in them and not even realize it. And so, a good one where people might engage in a defense mechanism and not realize it is like if you've ever had an experience where a coworker or it could be someone at school just seems angry out of nowhere and they're kind of taking things out on you for no reason. And part of that is that they may be angry about something they're dealing with in life, and it could be COVID, it could be something else. It is often a combination of things where somebody may have a tough day at work and they get a flat tire and their kid has been sick with COVID and all these things sort of just add up and it kind of boils over and then they take it out on somebody else. And the classic sort of example is like you can imagine a boss doing that. They take it out on an employee. The employee takes it out on their spouse takes it out on their child takes it out on the dog takes it out on the cat. You know, just this trickle down of dominoes of anger where people aren't even really sure of where this is coming from. But a lot of times it's just, you know, COVID related sort of stuff, or that's an exaggerating sort of factor that's involved.
Yeah. Yeah, I had a really interesting conversation with a principal on a similar theme where we were talking about, the health risks from COVID and what school could do to uh, reduce the risk. And I think everyone understands that you can't eliminate risk,
Right.
right? You can reduce it, but there's always going to be some amount of risk. And we got on to talking about the fact that there's a lot of asymptomatic spread of COVID, and that means that you can't just rely on if someone's sick, then don't come to school or don't come to class. And then we got talking about the fact that there's some evidence that's been around for quite some years now around airborne spread of viruses, and therefore you can't just wipe surfaces, and you can't washing your hands is a great idea, but it's not going to prevent people getting infected with COVID or other airborne viruses.
Yeah.
And we got to this point in the conversation where it was clear that there was a lot of cognitive dissonance in this person's head. And it seems like that's a real challenge for people, particularly in leadership roles where they have some responsibility for health and safety. And I
Yeah.
think, so really interested in your thoughts on this, because there's this concept of post-decisional cognitive dissonance. It seems like a real phenomenon where if somebody has made a decision that says, COVID's a cold, we don't need to be that concerned about it, and then they're presented with facts that kind of contradict that, it's extremely difficult, understandably, I think, for that person to then say, okay, I need to correct my thinking, but I also
hmm
need to acknowledge that it's been incorrect for some time.
Yeah, so this idea of cognitive dissonance is basically that people have their cognitions, their thoughts, and then they have their behaviors. And if these ever don't match up, that causes all this psychological tension that people have a hard time resolving. And so you can't really sit in this state of this unresolved psychological turmoil. So what you do is if your thoughts and behaviors are at odds with each other, you're going to either change your thoughts or you're going to change your behavior, right? And so this happens a lot where people have been engaging in some kind of defense. Pandemic is over, COVID is over, whatever they want to say about that. Um, and then reality starts to percolate in. They hear something that's kind of contrary to this narrative. Maybe someone they know gets COVID and they think, well, I was told this is over. What is going on with this? Um,
Hmm.
but the defense mechanisms are all over the place. And so increasing in complexity too. So you can have something like reaction formation, which is where people might start to realize, this whole pandemic situation is not entirely good. There's some bad things happening too, but they kind of suppress this reaction of like sadness or anger, and they try to just focus on the good. Like it's good that kids got infected because that means they're protected for a while or something like that. It can get to kind of these rationalizations where a good example of rationalization would be, you know, the president said the pandemic is over. The World Health Organization has said that it's not airborne. They have said contrary many times, but people can kind of cling to bits of evidence or advice that they like. The CDC in the United States, the Centers for Disease Control, says do a lot of hand washing. Um, uh, the California Department of Health, California is having a surge here in the U.S., and the California Department of Health just focuses on vaccinations, which are very good. But again, you need a lot of different things to help with a big problem. Um, so it's just such an elaborate network of these mechanisms people have to try to push this stuff down. And as they start to get evidence, it creates this tension of like, what is the behavior? The behavior has been to not take COVID very seriously. But now something is causing problems with this cognitively where they read a study, somebody gets infected, they know somebody that died after they had COVID recently, and it's kind of throwing things out of whack. And so what people will typically do is they will, instead of changing their behavior to bring it in line with this cognition, what they'll do is they'll just change their cognitions. They'll just
Hmm.
continue to engage in these sorts of defensive processes. And imagine you were the leader of an organization, or even kind of a mid-level manager, right? Um, you have one has done things that potentially put other people at risk and maybe led people to get infections. Statistically, maybe someone has developed long COVID. Maybe someone made a decision in an organization that led one person to get infected, and that created a chain of infections that 20 people down the line led someone to die. Um, if you actually try to grapple with that statistically of just what some of these decisions have led to, the consequence for people can be, wow, I did something that may have disabled someone or may have led to someone in the community that none of us knows to have had a heart attack and died. And
Hmm.
so that's very difficult for people to sit with. And so that leads to a lot more defense mechanisms. And so you're talking about airborne transmission. The risk we're mostly talking about is like these virus-laden aerosols floating around in a room that's poorly
Sure.
ventilated, so you could get sick from somebody across the room, basically. But so, a lot of people kind of didn't know this stuff. I mean, the historical understanding for most people was you prevent infectious diseases by washing your hands a lot, right? And you cover your sneezes and all this sort of stuff that's just not very effective against a highly transmissible airborne virus. But
Yeah.
if you're that person who's in charge of these decisions that potentially led to these bad outcomes, you just want to dismiss it as no, it's not airborne, because it's too damaging to admit that you could have made decisions that led to all these things to happen. So, but another one would be, maybe you buy into airborne, but then you start to engage in these more sophisticated defense mechanisms. You start to rationalize what you did. Well, everyone else was doing the same thing. Everyone else is doing the same thing now. Um, you may try to intellectualize it, which is like rationalization is like you come up with kind of a short, quick argument, but intellectualization is when you get into like these deep essay length sort of arguments. And you could really imagine somebody engaging in that of like, you could start with other people didn't know this, other people still aren't doing anything. Even if we did something, everyone would just keep getting infected all the time, which is not true. You can do a lot of
No,
things that bring down the risk. You can cut the risk in quarter very easily, and that's fewer infections for people.
for sure. And on the intellectualization challenge, I've had many conversations with people who are, they've science or medical backgrounds, and they'll make arguments like, "Well, I read this one study, and it had this really serious flaw that, it was statistically not the right method to use for the type of study that they were conducting," or some argument, and they say, "Therefore, I'm going to discount all the science that says that, we should be concerned about the long-term health effects of COVID or airborne transmission or whatever the factor is." And I find that a really interesting one to observe because people like to think that they're rational and smart.
Mm-hmm.
And in many ways we are, but then in other ways, as you've just described, if there's a psychological cost to that, people will do things and come to conclusions that are not rational and objectively not smart.
Yes. Yeah, and I think it's very easy to do that with scientific sort of papers because any paper is going to have flaws in it, and it has to. I mean, it's impossible. So, attention is people want to know about like if we see long-term outcomes of COVID infections, a lot of those data are from early in the pandemic when a smaller percentage of the population in their sample is vaccinated. Um, and so, people would like to know are the infections people are getting today in August 2025, is that still leading to long COVID at the same rates or what's going on with that? But you can't have a study published today that has long-term follow-up data. It's
For sure.
just logically impossible. And so it's always going to be somewhat outdated. There's always going to be a new variant. And so, if you're in that rationalization, intellectualization mode, you can always tell yourself the current variant is probably milder and is not causing all of this, right?
Yeah. And I guess this comes to the precautionary principle that,
Hmm.
people in the medical world understand very well. But effectively, you can summarize it by saying that if we have imperfect information, we should err on the side of being cautious in order to protect against possible serious downstream effects,
Yeah.
even though we may not know for sure what those effects are. But if the information that we currently have is credible enough to say, well, it warrants some caution, then that's the rational decision. But it's really interesting to see that there's a lot of people who don't make that decision and don't err on the side of caution. And it seems to be almost this concept that people describe as magical thinking.
Hmm.
It's kind of maybe it's one of those mental gymnastics that you were describing before, where people manage to concoct a worldview that says it will all work out fine. And I guess it's probably normalcy bias, right? That most people have never lived through a pandemic in their entire life. We're not used to the idea that large numbers of people could get ill or could have long-term health consequences from a virus that's seemingly everywhere. So this is not a thing that our brains are accustomed to.
Yeah, I agree. And yeah, it's fun talking to you because we use a lot of different terms. And the interesting thing in psychology is you'll have these different areas of science where people are studying seemingly unrelated problems, but it all becomes relevant from a COVID perspective because there are all these little tricks or mental gymnastics people are doing to
Mm.
try to suppress their anxiety about their lack of COVID mitigation and the consequences of that. Um, but I think you're right about the normalcy bias in particular. The people that I know of who tend to take these issues most seriously are a few main groups, and we have data on this actually that I haven't published yet, but we have a paper in progress that we'll publish soon. I'll probably do a town hall about it or something. Um, so I run this COVID dashboard in the U.S.
Mm.
and we put up a survey for about I think 6 weeks last winter, and the survey was pretty basic. It was just asking people about their demographics, their health history, what kind of COVID-related behaviors they engage in, and what do they find most useful about the dashboard. Just kind of trying to get to know the people using this website, and I thought naively that it was mostly just going to be kind of intellectual, scientific sorts of types of people like myself who are, taking this very seriously and just looking at the numbers. And that's somewhat true. That's a good proportion of the people, but I would really describe it as kind of three different groups. And so one is just kind of the super sciencey group that can tolerate more awareness than most and kind of gets into all these numbers and can avoid some of those defenses. Um, but the next sort of group was patients who have some kind of serious illness, or chronic condition, or for whatever reason knew to take this seriously early on and have continued to do so because they continue to rely on the precautionary principle, or they've maintained enough awareness that they can still see that enough bad things are happening. And then the third group is basically family members of somebody who has a serious health condition or chronic condition, or has dealt with early death in their family, or something like that, that has kind of allowed them to step into that place and take it a bit more seriously than people who have never really experienced any of this firsthand.
We should talk about mask wearing because I think it's an interesting challenge, and so I suspect that some of the people watching this video, and certainly a lot of the people who've done the COVID Safety for Schools course or watched any of the previous interviews that we've done, tend to be people who already have some awareness of the science and some concerns, either because they have a health condition that puts them at higher risk, or simply because they've said, a 1 in 10, 1 in 20 chance of developing long COVID with each infection is not a risk that sounds very appealing, and so I'm really keen to not take that risk. A lot of those folks are in this interesting situation of being lone maskers or among a very small number of people in their school or in their workplace. Mm-hmm. So, and I've spoken to many teachers who are in this situation, as well as some school students who've said it is extremely difficult because of the stigma attached to wearing a mask, and the, as we've just said, the kind of prevailing view that COVID's over and it's no big deal, and mitigations like wearing masks are no longer necessary. Really interested in your thoughts on what strategies those people can use to deal with that stigma and that kind of sense of being the outlier or the person who's different, and if there are any strategies that might help to maybe bring some others who are perhaps would be willing to wear a mask but just need to have that kind of encouragement or to not be the only person.
Yeah, I think it's really difficult. My oldest, who's 7, just went to summer camp, and the reason he went to the summer camp was because masking was required, of everyone. And it was not something I set up, it was something that other people set up locally. And for me, I think for young kids especially, it would just be very difficult to mask in situations where no one else is, because there's the potential for bullying or that sort of behavior. I'm often in meetings as a scientist where I'm the only one masking, and when you're doing that, you're disrupting people's defense mechanisms. You're bringing that anxiety back to the surface because they can't just push it down when they see somebody who seems to know something or take something more seriously than them. And I think for an adult, when they see a kid masking, that really throws them for a loop, because here this kid seems to know something, or is claiming to know something that they don't know. And we discuss this in my family a lot, so much so that I have twins who are 3, and they'll talk about this stuff, or they'll hear me say something and repeat it back. And my 3-year-old daughter was recently telling her twin brother, to know and not to act is not to know, which is an ancient proverb. But it's like you have kids who are basically understanding this. If you take COVID seriously, you have to mask. And when you see a kid masking and you're an adult who doesn't, it throws that off. When people see me as a scientist and they know they can take me seriously on all of these sorts of issues that they want to ask me about, but then this other one, that they're not quite as sure about, then it's causing that anxiety. So it's an immense challenge. Some things that would help. I think if you can be masking in a room and make that more comfortable for other people, you may develop allies. And so there are times where I'm in a very large meeting and there may be two or three other people there who will be masking. I don't think out of solidarity, and I don't think because I have some mid-level manager sort of power over them in some very loose sense, but because they want to, and I'm making it a safe place for them to mask because they know I always will be.
Yep.
So therefore, they're comfortable to do that. So that's one thing. Um, People can think about if there is a certain aesthetic that makes it easier for them to feel comfortable masking. So in the United States, a lot of young women who mask will have these mask chains, which are like a bracelet that they've taken apart and run across their mask to just make it look prettier. Um, I've used some particular type of stickers. They're called dry transfers that you can put onto a disposable mask, and I'll put like a cancer ribbon on it or something like that, and just to add some flair if that's what makes people comfortable. Some people prefer black N95s or similar high quality masks.
Mm.
I have a bunch of different flow masks. Do you have flow masks in Australia? Do you know?
You can get them. I have one. I'm one of those people for whom there's not very many masks that are a good fit for my face shape. So I tend
Gotcha.
to be a 3M Aura person.
Yeah, exactly. They happen to fit me well, and they have a bunch of different cover pieces for them. And
Yep.
so I have like four of those now, and I can kind of change things up, depending on what I want to deal with. Um, but it kind of depends on your mood too. I mean, I do have some of these decals that have like a big COVID virus that I can just slap on there if I want to
Yeah, right. I
really
wonder,
percolate the tensions.
do people rationalize? I mean, you work with cancer patients, right?
Sure.
And people will understand that. So do people kind of rationalize your mask wearing by saying, oh, well, Mike's special because, he has to protect the high risk people that, he interacts with. And I'm wondering whether, I mean, I've certainly experienced this, that if you don't appear to have any kind of special reason,
Hmm.
in quotes, to wear a mask, that seems to trigger an even greater level of kind of anxiety amongst people who say, well, it's not because this person works with cancer patients or has, some health condition themselves.
Yeah, that's definitely true. That's been my experience. I would say the past year, though, people don't even care about that very much.
Mm.
So until maybe a year ago, just knowing that I work closely with cancer patients, what we do research involving patients who have very serious cancer diagnoses, where we're going to their homes for home visits because we're doing
Mm.
research studies with them, surveys and things like that. Where it's burdensome. I mean, you might have somebody who is so exhausted from their treatments that they're perking up for 40 minutes to do a survey with you,
Mm.
and so we go to their home just to make it very easy. And myself and anyone on my team wears a well-fitting N95 mask. Um, and so, I'd say until about a year ago, um, anyone I might have a casual interaction or any acquaintance would kind of take that as like, oh, that kind of makes sense. Um, or when my twins were younger and people did kind of understand, oh yeah, young children, babies, yeah, you don't want a baby to even get a cold or anything like that. They get sick so easily, and they have to work up to all their vaccinations and everything.
Yeah.
That was more common, but now I don't think people even get that, just because you're seeing at cancer centers, you're seeing at neonatal intensive care units, people not wearing masks, and
Mm.
at the neonatal intensive care units, people used to mask often pre-pandemic. So
Yep.
uh, it's kind of
We've gone backwards.
unraveled, yeah.
Yeah.
So I agree with you, but I think the last year, um, the contextual factors have kind of fallen away, and it's more people want to see like, what is your illness or something. But that's just
Yeah.
part of them trying to justify it to themselves, to push that back down below the surface, to engage in some othering of, oh, you have this condition, I don't have that, so I don't need to be
Yeah.
worried about that, putting aside that they could infect you. Um,
Yeah.
so,
Yes, indeed. You said something earlier which I thought was really relevant. It was about, if you know more, you can take action based on that knowledge. And people like to think that that's what we do, right? If we have some information, we're rational beings. We'll act rationally with that information. But there are some studies that show that in many situations, people don't act rationally. And one example that I thought maybe you might have some thoughts on is this thing called the bystander effect, which is when we're in an environment with others, there's a kind of a diffusion of responsibility that says, well, yeah, I recognize that there's a situation where I perhaps should intervene or take some action, but because there are others around, well, maybe they should take the action. And it's often unconscious, and people don't say, I'll choose to not act. They simply have this kind of barrier to action. And there's a really interesting experiment. It was called the smoke-filled room experiment in the 1960s, where they got a university student to sit in a waiting room to do some supposed experiment. And while they were sitting in the waiting room, they piped some smoke into the room. And what they found was that if the student was alone, most of the time that student would get up and investigate, and then they'd go and find someone and say, hey, there's smoke coming into the room, like this, we need to look into this. But if they put them in with confederates, so with paid actors who were tasked with not responding to the smoke, then this student, who was the naive participant, actually took no action. In almost all cases, they just watched the smoke billowing into the room. And I feel like that's probably an interesting element of what's happening, particularly in school environments where there are many kind of bystanders, if you like, for people to get those social cues from.
I agree, and I think that's really important in terms of the unraveling of mitigation. So when things when anything went from a requirement to a recommendation or suggestion or optional, one thing that I think surprised a lot of people was how quickly behaviors changed. And this is true at the universities as well, here in the US anyway, of you could go from, say, a masking requirement. A lot of universities here would base different sorts of requirements on levels of transmission, okay? So they'd try to turn things on and turn them off, and eventually they just kind of gave up. But you would often see very stark changes in behavior. And I think what would happen is, you'd get an email, and I'm saying universities, but this could be any large organization. You get an email that says masks are no longer required, and so a few people then take off their masks, and then within 3 days, it's like almost no one is wearing a mask at all. And it's kind of like in your smoke-filled room situation, if an announcement came on that said fires are okay, you can throw away the fire extinguishers or something like that. And so a couple people start chucking the fire extinguishers, out the window. And then everyone else is like, well, they threw those out the window, so this smoke is not a big deal. And so it just kind of it normalizes it. It's even more extreme than just observing somebody doing nothing. It's observing somebody doing just very counterproductive sort of behaviors. And so I think that explains why a lot of things change quickly, and people, even who were well-intentioned, felt like it was very difficult to act or hold any ground or try to enforce any accountability in those sorts of circumstances.
Yeah. So I guess where this leads to is the kind of practical question of what can we do about it, and particularly in the context of schools, if there's a family or a member of staff who kind of sees this as a serious health risk and wants to kind of raise the topic. We've talked about some of the psychological defense mechanisms that are very real, and certainly they're very widespread, and I totally agree with your point that we all suffer from them to some extent at certain times. So let's talk about practically what those individuals can do to raise these topics in a way that minimizes the risk of triggering a really strong defense mechanism. And so obviously with the objective of getting some agreement to take some actions and to reduce the risks.
Yeah, I think it's really challenging, and if I had a lot of faith in any of the suggestions I could offer, then I would be helping everyone to enact them, and we'd
Yeah.
see massive changes. Um, my perspective is pretty pessimistic, and that's why we homeschool personally. Is I just kind of saw the writing on the wall leading into like the original Omicron wave of just schools not doing enough, and just imagining how over time that would just become a less tenable situation, at least here locally. Um, but there are things that people can try to do. So I mentioned like this summer camp that we have here locally. Um, I think people can start to do more events along those lines. And so if you can make something a normal sort of thing that people do, then
Mm.
that helps get the ball rolling. And if there's an example people can point to where, oh, there was this event where high quality masks were required, there was good ventilation, there was supplemental filtration, there was air quality monitoring, there were free rapid tests in 2025, and this went on for 2 weeks, and
Mm.
everyone complied with it just as they had the previous several years, then people have to think more about like if they are doing that, why aren't we, or why can't we, or why can't we take some step in that direction?
Sure.
So I think that's a part is trying to do something in your community that provides a positive example. And when you provide a positive example, you're not just doing it for your community. If you can get the word out about it on social media, you're
Mm.
setting an example for so many people. And in psychology, that's the principle of modeling. Of you see someone do something, you're much more inclined to do it yourself. And
Yeah.
that's true of humans, that's true of many non-human animals. It's very, very powerful. And so anything you can do along those lines can be very helpful locally, but worldwide. Um,
Yeah. I read in Malcolm Gladwell's Revenge of the Tipping Point, so the kind of revisit of the Tipping Point book that he wrote 20, I think it's 25 years ago. And he talks about a critical mass to affect change within a group of people, whether we're talking about, a workplace or society on a larger scale. And it's really interesting, this kind of observation that it's extremely difficult to get change when you've got one or maybe a small number of people in a group. But in every group there's a critical mass or a tipping point, and if you reach it, then it's actually much easier to get more and more people. You may not ever get to 100%, but you probably don't need to. You just need to get past that kind of one or two people in the group.
well, and the thing is we're not going to see universal precautions at every school in the world, but you may be able to do something that makes the situation more tenable for yourself locally, or leads to more options for others locally. And if you set a positive example and somebody else does it, it can kind of feed off of each other. And so yeah, I think it's important just to go into it with a sense of reality about the limitations of what potentially could be accomplished, but also the optimism that you potentially can have some wins and make things better for yourself or your family. So that's kind of my backdrop of what I would have in mind in terms of concrete suggestions for people who are going to a traditional school, whether it's someone who's a teacher or a student or another worker in the school. There's some things that you can really do to promote your own safety. And so the biggest thing would be if you're wearing a mask, to wear a high quality, well fitting mask. And so what constitutes high quality varies with different rules across different countries, and those rules are sometimes changing and whatnot. In the United States, it's an N95, but
Yep.
there's different letter number combinations. There are a
Mm.
lot of very well-intentioned people. I would say most of the people in the community that I see are wearing a mask in the United States are
Mm.
wearing a baggy blue procedure mask.
Mm-hmm.
And it's because they understand that it's serious. They've seen enough people get sick and bad things happen, and they can't
Yep.
get by economically, but there's still that gap. But yeah,
Mm.
different people will have different levels of understanding. I've started using different social medias more, and even TikTok a little bit. And I'm a newbie to this, but there's a lot of people on there who talk about mask tips. And what I've often been surprised with is while they're giving tips, how poorly their mask fits them, where they've
Right.
got a KN95 and the nose is really pointy, and they've still
Mm,
got this gap right here and right here. And so
yep.
people could, make that more of a focus, and there's tips people can find online for how to do DIY, do-it-yourself fit testing. So
Sure.
that's a big thing. Another thing would be if people can afford some kind of air quality monitor. You can get a CO2 monitor. You can use that to assess what level of ventilation is happening in a room. If the ventilation is great, if you're getting a lot of outdoor air coming in, that is helpful. That buys you time, that buys you a worse fitting mask. It just reduces your risk a lot, especially in these
Sure.
situations where there's high transmission or multiple people sick. Um, and then the other thing, and this is where you and others probably run into a lot of barriers, is doing things to improve the air quality if it has been found that the air quality is not great. And so
Yep.
at the big scale, that would involve advocating for improved HVAC systems, air conditioning systems that bring in fresh outdoor air.
Sure.
But that may involve adding HEPA filters or DIY air purifiers. And
Yeah.
that is often a struggle, especially for places that never bought into it. And now you're trying to get buy-in 5.5 years into this situation.
Sure. And of course, as I've experienced myself and also talking to many other parents who have CO2 monitors and will send them with their child to school, which of course isn't something that you want your child to have to, carry an air quality monitor.
Yes.
We don't ask them to test the quality of the water that they have to drink when they're at school. But nonetheless, uh, showing the school CO2 charts from that monitor that show that the ventilation's not good and the CO2 is really high has probably shown to be one of the most triggering things that a parent can do in terms of interacting with the school. So, but I don't think there's really much of a solution to that unless you've got any good tips for broaching that.
Well, I think it is triggering. And when I first got a CO2 monitor, I mean, it was just amazing to me learning places that you thought were safe that were very unsafe, and sometimes vice versa. Um,
Sure.
One of my collaborators says, once you see it, you can't unsee it. And
Yep.
that's how powerful it is. And if you are willing to act on that knowledge, it's a very powerful tool. If you're somebody who is trying to suppress awareness, that's really triggering and leads to a lot of defensiveness. So that is a challenge. Something that some people will try to do is to try to make it more general and less about COVID. So about reducing absences from school, reducing overall illness transmission of colds, flu, and COVID, um, making it about helping people who have asthma and other health conditions. And that is something I've observed in the studies we've done where we're giving patients with cancer DIY air purifiers
Mm,
is sometimes one of the first observations they'll have is, wow, I just feel like I can breathe easier, or my daughter who has asthma has had a lot of improvement in her symptoms since we got one of these. Why did we never know about this?
sure.
Uh, so it's still tough because the COVID mechanism is still so powerful psychologically that the mind is wanting to see through these careful ruses you've set up.
Yeah. Yeah, for sure. Mike, are there any topics we haven't covered, or are there any last pieces of advice you'd like to offer anyone who's interested in making changes in their school environment?
Hmm. Well, I just want to express empathy for everyone who's going through this. You mentioned, how absurd is it that we're sending kids to school with CO2 monitors, as my child recently did surreptitiously at camp. Um, and what is it like that I have to rely on a 7-year-old to wear an elastomeric mask correctly and trust that they can do that in a world where many adults do not understand the importance of that, and even when they're trying, can't necessarily pull that off very effectively. So
Yeah.
people really have a lot of obstacles against them. Um, I would encourage people to take the long view. So, in terms of kids, you're setting up kids that are going to be scientists, they're going to be clinicians, they're going to be public health advocates. They may pursue public health or related sorts of positions as a career. They may pursue adjacent career pathways that don't exist currently. So it's really setting them up well. Any infection avoided is very useful when you're thinking about long term as people are stacking up cumulative infections and that somehow reaching some kind of tipping point where people are realizing that's serious. What if it is the 10th infection that is, when on average people have 10 infections, that's when people see the seriousness of this. Well, if your kid only has 3 infections at that point, and then the world is caught on and is willing to do something more substantive, that's huge. And so
Yeah.
that's a very strange proposition for anyone to make, but it's the wise proposition. So I just want to express that empathy. I encourage people to use a multi-layered approach to all of their mitigation and to approach all of these activities with a sense of frankness and awareness about what they can accomplish, what they can't readily accomplish, and being willing to set boundaries. And so the boundaries could be with a school where people say, I'm not going to go to that school anymore. We're going to switch to homeschool or a virtual learning environment or some other school that has better ventilation to the extent they have choice over any of this. But people can also set boundaries with family because people are going to deal with these issues with extended family who have different levels of understanding and precautions and all that as well.
Yeah, for sure. Mike, we'll leave it there, but thank you very much for sharing your insights. I really appreciate it, and I'm sure people watching this video will have got a great deal out of it.
Thank you. I appreciate you for hosting.